This is the Voice of Health, sharing health principles, inspiring healthful living, because a healthy lifestyle is medicine. Broadcasting every Monday, Wednesday, and Friday at 11 a.m. Brought to you by the Lifestyle Medicine team of Adventist Medical Center Manila, Health Ministries Department of North Philippine Union Conference, Adventist World Radio, and Hope Channel Philippines. Hosted by Miss Lady Mataya Dapat. This is the Voice of Health.
At malusog na araw po sa inyong lahat. Welcome to the Voice of Health, trumpeting heaven's prescription that lifestyle is medicine. Sa araw na ito, muli tayo po ay sabayang napapanood sa GSAT Channel 37, Local Channel 45, at sa maraming Facebook pages tulad ng sa Adventist Medical Center Manila, Hope Channel North Philippines, Manila Adventist College, Hope Radio Toledo Cebu, Adventist Hospital Santiago, at marami pa pong iba. Ganun din, tayo po ay napapanood at napapakinggan sa teleradyo ng Adventist World Radio Luzon, Philippines, at mamayang 12 to 1 sa DWBL 1242 kHz. Mga kaibigan, ang atin pong pag-uusapan sa umagang ito ay napaka-importante mula bata hanggang pagtanda. Ito po ay paano nga ba natin dapat gamitin ang mga medications na ating dapat inumin sa pinakang safe na paraan. Tama po yan, tungkol po sa pag-inom ng gamot, tamang paggamit nito, at yung paano natin ito ikikip, marami pang iba. Yan ang ating mga matututunan sa araw na ito dito sa Voice of Health. At dahil tungkol po sa gamot, ang ating pag-uusapan, nararapat lamang po na ang ating makakasama ay isang pharmacist. Yes, tama po kayo. Hayaan niyong ipakilala ko ang atin pong guest speaker sa araw na ito. Una, siya po ay isa sa mga program chairs dito sa ating college, Manila Adventist College. At maliban dyan, hayaan niyo pong basahin ko ang aking kodigo. Ayan, siya po ay isa sa mga accreditors ng pharmacy program sa Philippine Association of Colleges and Universities Commission on Accreditation. Kaya alam niyo po na talagang specialista at eksperto ang ating makakasama ngayon. Accreditor po siya. Maliban po dyan, member po siya ng Asian Qualitative Research Association, Bureau of Speaker for Continuing Professional Development dito sa Pilipinas para sa mga pharmacist. At syempre, maliban po dyan, siya rin po ay associate member ng Cluster 3 Division 4 Pharmaceutical Sciences of National Research Council of the Philippines. Napaka-passionate po ng ating makakasamang speaker sa araw na ito. Atin pong sama-samang i-welcome si Ma'am Vina Rose Dahilig-Talan.
Good morning po, Ma'am Lady. Good morning po sa lahat na kasama natin ngayong umaga.
Maraming salamat, Ma'am Vina. Alam namin, exam week ngayon ng mga estudyante mo. But you're here with us.
Yes, Ma'am.
Ma'am Vina, bago natin puntahan yung depth ng ating usapan, may una lang akong tanong. Kasi napaka-importante na ma-share ito ng atin pong mga taga-subaybay. Ma'am, bakit ito ang napiling topic sa araw na ito?
Actually, Ma'am Lady, naisip po natin sa gitna po ng pandemic, karamihan po ng mga tao parang nag-iisip ng mga bagay kung paano po mapapabuti yung kanilang kalusugan. Pero at the same time po, medyo nakatuon po tayo sa iisang sakit, pero kailangan din po nating maintindihan na hindi naman po natatapos ang sakit kagaya ng hypertension at diabetes nang dahil lahat po tayo nakatuon lang sa COVID. So, inisip po namin na maganda po sanang maunawaan din ng mga tao kung paano mapangalagaan sarili nila sa tamang paggamit ng gamot na hindi lang po lahat ng attention natin muna nasa COVID.
Oo nga, Ma'am, ano? At I really agree po sa sinabi niyo, Ma'am Vina. Kasi ang mga tao ngayon, palaging nasa bahay. Nandun yung kanilang mga maintenance. At kumbaga, maraming guilty dito. Isa na rin siguro ako doon, ano? marami rin ang nagsusubok na mag-self-medicate. Yan, lahat ng yan atin pong mapag-uusapan. Pero bago ang lahat, inaaniyahan ko po kayong i-share ang ating program dahil alam naman po natin dito sa Voice of Health, sigurado po mabubusog kayo ng information na talagang kailangan nyo po pang araw-araw. At wag po nating palampasin na ito'y ipadala sa ating mga kamag-anak, mga kaibigan. Baka meron po silang mapulot na impormasyon at maitama kung meron man silang maling gawi para sa kanilang kalusugan. Bago nga po tayo tumuloy sa ating usapan, mga kaibigan, panoorin niyo po muna ito.
Lifestyle is medicine. L is for laughter, the stress reliever. I for interaction, the friendly immune booster. F is for food and fluid, the taste of health and the thirst quencher. E is for exercise, the preserving power of motion. S is for sleep, the body restorer. T is for temperance, the key to balanced life. Y, your faith, the divine healer. L is for light, the energy giver. And E, environment, the lifesaver. Pure air, sunlight, abstemiousness, rest, exercise, proper diet, the use of water, trust in divine power. These are the true remedies. Indeed, lifestyle is medicine.
Indeed, lifestyle is medicine. At yan nga po ang intervention program na available po dito sa Adventist Medical Center Manila. Isang 6 weeks online program kung saan marami po kayong matutunghayang mga lecture at matututunan na mga recipe kasi po may cooking demonstration pong kasama dyan. Maliban pa po doon, makakatanggap kayo ng workbook at dahil ang dami pong espesyalista na kasali sa intervention program na iyan para na rin kayong nagpa-consult sa OB, sa men's health urologist, sa orthopedic, sa lifestyle medicine specialist, sa mga physiotherapist at nutritionist na kasama dyan. Ayan nga po mga kaibigan, November ang simula ng sunod na batch ng Lifestyle is Medicine Intervention Program. Ilalagay ko po sa comment section kung paano kayo makaka-join sa programang ito. Balik po tayo. How to use your medication safely. Welcome back, Ma'am Vina.
Thank you, Ma'am Lady. Okay po. Before we start po, is it okay po to have a PowerPoint that I can share po with our
Go ahead,
friends?
ma'am.
Okay po. Sige po, I'll just share po my screen. Ayan. So, okay, ayan. Hope it's okay na po. Hope that everyone can see the screen na din po. Ayan, okay po. So for this morning po, ayan, ako po bilang inyong pharmacist ay naandito upang magbigay ng liwanag sa mga ibang bagay na gusto po nating malaman tungkol sa gamot, pero hindi natin naitatanong minsan sa ating mga butika kasi minsan kulang sa time, nagmamadali na din tayo, no? So ang ating pong topic for this morning, huwag kayong mahiyang magtanong, how do we rationally and safely use our medicines? Okay. So isang disclaimer lang po muna bago po ako magpatuloy. Again, we realize po no na ang pinaka-mainit na topic na lahat ng tao ay interesado ngayon ay of course tungkol sa COVID-19. At napakarami po nating mga gamot na gustong itanong kung mabisa po ba ito para hindi tayo magkaroon ng ganoong sakit. But hindi po natin i-discuss ang mga gamot na pwedeng preventive or symptomatic dahil unang-una po pagka diniscuss natin ito kailangan evidence-based at hindi ko po nakikita na ako ay nasa posisyon para magsalita mag-isa about the medicines because again for this type of treatment it has to be intercollaborative. We need to have a panel of healthcare practitioners, your doctors, the nurses, the pharmacists, the medtechs, no, they have to be here also to discuss us what would be the best treatment that works. So hindi natin po itatouch ito sa ngayon. Okay? Saka very controversial na topic po ito na wala pang sapat na evidence unless those that are actually used in the hospital. So hindi po natin siya itatouch ngayon. Pangalawa, despite the ano po natin, no, the catchphrase, hindi po ako affiliated with any brand or any drug manufacturer, no. Ako po ay empleyado, no, ng Manila Adventist College at hindi po ako magpo-promote ng kahit na anong brand ng gamot. Although there was one time, no, na nais po tayong lapitan para sa isang gamot, pero si Jody na yung naunang nag-yes, si Jody Santa Maria. So, siya na lang. Who knows, no? Baka in the future. Ayan po. Pero, yan. I am not affiliated with any drug manufacturer. Ayan. Okay po. Earlier, ayan, kanina napanood po natin yung video na ipinapakita po the program that is offered by our hospital, no, Adventist Medical Center Manila. We are promoting the program Lifestyle is Medicine. And as a pharmacist po, I would also say that actually the best medicine is really Lifestyle is Medicine. In that video that we watched earlier, we found out, no, lifestyle stands for laughter. We know that laughter is really the best medicine. In the time where we are told to have social distancing, no, especially mental health awareness month po tayo, it becomes difficult for us to reach out to other people. Therefore, interaction is really necessary. Okay. Food and fluid, of course, exercise, sleep, temperance, everything should be taken in moderation. Our faith is the most important anchor that we have in these trying times, no? The light, of course, coming from God, and also the light from the sun also nourishes our body, no? And also the environment. So, as a pharmacist, I agree and I would advocate that really the things that we have enlisted here is the best medicine for our body. And you might be surprised, no? As a pharmacist, I would tell people, maybe we are taking a lot of unnecessary medicines. Kasi sabihin nila, I want to promote or maintain my health. But we also have to remember, if something is not broken, do not try to fix it. Hindi naman sira, bakit pa natin kailangan inumin? Only take medicines that you know when there is an absolute indication for it. Kasi kailangan natin. Again, if it is not broken, do not try to fix it. Because you might be surprised that our body has an amazing capacity to heal itself. Kaya naman ng ating katawan na pagalingin. Kung maaalala niyo po, nung tayo ay mga bata pa, no? Pag tayo ay nagkasugat, di ba, nag-aalala yung mga nanay natin, hala, may sugat sa legs, no? Baka ang tawag niya, peklat yan, hindi na pwedeng mag-best in long gown or best in swimsuit yan. Kasi magkakapeklat na yan hanggang lumaki. But, as time goes by, especially for children, makikita po natin, gumagaling naman ang sugat mag-isa. Of course, we can put antibacterial creams or some natural herbs, no, para hindi siya ma-infect. But the body can really heal itself. Kaya po ng katawan natin. Ganun ka-amazing ng pagkakadesign ni God sa ating katawan. As mentioned kanina, sabi natin din po, di ba, food and fluids. Okay? We would like to think of nature, ang ginawa na mundo sa atin ni God, as God's pharmacy. Actually, everything that we need to heal ourselves, our minds, our body is already in nature. So sabi nga po ni Hippocrates, let food be your medicine and medicine be your food. The nourishment that our body needs can be derived from nature. Kaya we call it God's pharmacy. So ayan po ay isang poster po na ginawa din ng ating mga estudyante sa Manila Adventist College. And they believe po, no, His love, His compassion is everything that our body and minds need. Okay. Now, for the presentation, for the discussion that we have for today, pag-uusapan po natin, na-mention kanina ni Ma'am Lady, all about self-care. Kasi we also have to acknowledge at these times when mobility is really very difficult, mostly it is left to us to know how to properly take care of ourselves. And with the choices that we have, when you go to the pharmacy, diba, there are some medicines that you can just easily take off the shelves, no? maaaring ma-overwhelm tayo sa dami ng ating pagpipilian at ano ba talaga yung kailangan ng katawan natin para masiguro na hindi tayo magkakasakit. So pag-uusapan natin po ito, no? And also, we will talk about the common misconceptions of medicine. Susubukan nating ituwid yung mga bagay na maaring alam natin pero hindi naman pala yun yung tamang paggamit ng gamot. And then, we will discuss, no, ano ba talaga ang gamot? Ano ba ang nature ng gamot? We will discuss its classification. Bakit ito direseta? Bakit ito over-the-counter lang? Okay, pag-uusapan po natin. And then, the common question that are always being asked to us, the pharmacist, no, totoo po ba na kapag branded ang gamot, mas mabisa? Pangalawang most common question asked with the pharmacist, paano nyo po nababasa yung sulat sa reseta? May inaral po ba kayo sa school nan? So, ayan. But that is beyond the scope of our discussion for today po. So, ngayon, pag-usapan natin, ano ba yung branded? Ano yung generic? Ano yung prescription? Ano yung over-the-counter? At ano yung home remedies? And then, next po natin is how do we take our medicine safely and responsibly after knowing the nature of the drug? Ano ba talaga ang gamot? And then, last po natin, we will have the frequently asked questions on medicine. Sabi ko nga po, wag kayong mahiyang magtanong. Kung hindi kayo magtatanong, ay ako na lang ang magbabato ng tanong. Sulit. Mamaya po, may na-prepare na rin pong question. Inuunahan ko na po kasi sila. Ayun po. Now, surprisingly po, no, even the World Health Organization advocates self-care. Na-mention po ni Ma'am Lady kanina, self-care po ang ginagawa natin ngayon. So, sabi ng WHO mismo, self-care is what people do for themselves to establish and maintain their health, prevent and deal with illness. Pag sinabi nating self-care, it is a broad umbrella term that encompasses hygiene, in the environment, in our personal hygiene, nutrition, the type and quality of the food that we eat, lifestyle, the things that we do, no? Environmental factors, our living conditions, the social habits, socio-economic factors, income level, cultural beliefs, and lastly, self-medication. So makikita po natin, according to WHO, self-medication is just one element of self-care. Yun po. Now, when you talk about self-medication, it is the selection and use of medicine by individuals to treat self-recognized illness or symptoms. Okay po. So, ito po yung makikita natin na framework na binibigay ng World Health Organization, and they're giving us 12 tips to be healthy. And surprisingly, all of the 12 tips that we see here are part of the Lifestyle is Medicine program.
Wow.
So, yes, so, ayan po. So, it is also in accordance actually with the WHO framework po. Now, when we talk about self-care continuum, ibig bang sabihin po nun na it is up to ourselves to take care of ourselves? So, hindi po, no? In this continuum that we see, kailan tayo magsi-self-care? Kailan tayo kailangan dumulog sa isang health professional? So, for the daily choices that we have, na parang, hindi sapat yung nourishment na nakukuha ko. That's when you can take supplements, dietary supplements. Supplement lamang po. No? Lifestyle, parang, hindi na tama na nakaupo lang ako sa bahay, no? Na 24/7 almost. No? So, I have to also mobilize myself. Self-managed ailments. Parang ano lang naman to, ordinary itch, ganyan. Or taking care of the skin, as mentioned by yung doctor na kasama po natin nung October 11, that's Monday, no? So, the things that we need to manage ailments, we can do self-care for that. Also, for the minor ailments, later on po, we will try to see what are the different minor ailments that we can do self-care with. Okay? But ultimately, kapag ang isang bagay po, kahit minor ailment na yan, pero paulit-ulit, nagiging long-term, that's the time when we begin to stop taking care of ourselves and realize, no, kailangan may wisdom din po tayo na, hindi ko na kayang i-manage to mag-isa. I have to consult the health professional na. Ayan, for long-term conditions or serious acute conditions, compulsory psychiatric care, something that prevents you into doing what you're supposed to do, no, mentally. Ayan. Or major trauma. In medicine and pharmacy po, trauma can either be a mental condition or kunyari accident, ganyan. So it could also be classified as trauma po. So in this continuum, pagdating po dito, that's when we really have to seek pure medical care. Somebody who would assume professional responsibility to us also. So ito po yung mga common minor ailments na kaya po ng ating mga over-the-counter medications. So simple acne, body aches and pains, ayan, common allergy, colds, cough, ayan. So ito po yung a wide range of ailments that we can easily do self-care with. Ayan po. But, again, taking into consideration the times that we are in right now, kapag pinagsama-sama po natin yung ibang ailment, like for example, hala, cold, hala, may cough, hala, may diarrhea, hala, may fever, hala, iba na yan. So, kailangan po, again, kaming mga pharmacists, we are not, we do not have the responsibility or we are not authorized to diagnose. Also, tayo po na mga pasyente, mga customer po, no, we cannot also self-diagnose. So if we have a merging of the symptoms, if we have more than one symptoms together, ang sabi natin self-care pero hindi natin sinabing self-diagnose po. So kailangan, let's kukonsulta po tayo sa doktor to have a proper diagnosis. And then the doctor will give advice and then we can continue that advice coupled with the proper self-care po. So, ayan po. Okay, when you talk about self-medication, kasi ang ating linya po ngayon, ang ating pong interest ngayon ay tungkol sa gamot. When you talk about responsible self-medication, it is the practice where patients treat their conditions with medicines that are approved and available without prescription, and it should be safe and effective when used as directed. Dapat ang gamot na gagamitin natin, no, dapat proven yung safety, yung quality, and efficacy. Dapat yung gamot na gagamitin natin para lang dun sa kondisyon na tinitreat natin. Hindi pwede yung, ay, subukan ko kaya kung tatalab ito. Hindi pwede. And then, medication should be specifically designed for the purpose and will require appropriate dose and dosage form. Having said that, let me address din po one of the common misuse of antibiotics, specifically yung mga amoxicillin po na ibinababad sa sugat. No? Meron po kasing mga iba na kapag nasugatan, binubudburan ng amoxicillin powder. At yun po ang isa sa mga ginagawa natin mga Pilipino na hindi po dapat maipagpatuloy. Kasi po, again, the main reason why it was formulated as a capsule, it means that it has to be taken orally. So, hindi po natin pwedeng sirain yung capsule at ibudbud na gawing pulbos. So, yun po ang dapat isa din nating ma-correct kasi mali po yun. Yung pong mga gumawa ng kapsula na yun, they have designed it in such a way that it will be better absorbed by the body that way. Kung nais po nating gamitin sa balat, yun po ang gagamitin natin mga creams and ointments na po. Ayan po. Then we have facilitated self-medication. Yung una, responsible self-medication, sarili, yung tayo mismo ang gagawa. Kapag facilitated self-medication po, it happens when the consumers seek help at the point of purchase for non-prescription medicines. So, kung nalilito po tayo no, sa mga choices ng over-the-counter na available po sa atin, pwede po kayong lumapit sa inyong mga pharmacist. Kapag kayo po ay bumili sa mga botika, no, kami pong mga pharmacist ay tinrain naman po no, para po tulungan kayong gumawa ng mga decisions nyo on self-care. Yan, para mag-guide din po. Now, we also have to remember, no, ang ating po mga customer or patients, they are not blank sheets or empty vessels. Actually, kahit po hindi trained in the health professions, you are already experts in your own, in your children's health. Because at some point in time, nangyari na sa inyo at hindi tumalab. That makes you an expert in dealing with that type of condition. Pwedeng may nasubukan na kayong ibang treatment, itong brand na to ay hindi tumatalab, hindi to gumagana. Yan. Meron kayong ibang idea kung bakit naging ganito yung kondisyon. Meron kayong mga ibang pananaw tungkol sa iba-ibang treatment. And you may have preferences for certain treatment approaches. For example, pharmacist would tell you that for as long as the drug is registered with the FDA, ang generic at ang branded ay pareho lamang kasi ito naman ay inaprubahan at inauthorize ng FDA. However, there are some people who would still have beliefs, no? Ito yung tumalab sa akin ito yung nagwo-work sa akin. And we respect that. Ayun po. So, dagdag na rin po natin, no? Ginagawa naman natin ito this pandemic. Now, how do we do proper self-care po during the pandemic? So again, ayun ma'am, we fuel the body by eating well-balanced diet, drink a lot of water, try to get 7 to 8 hours of sleep each night, exercise every day, take deep breaths, avoid risky or destructive behaviors, spend time outside, but follow social distancing guidelines. Ayun ma'am. For mental health naman po, ayan, we have to have a routine at home, focus on things that we can control, use technology to maintain social connections, and listen to music or read books, lean on your personal belief or faith for support, and acknowledge and appreciate what others are doing to help you and the community. Wag lagi din pong toxic kasi minsan kapag nakikita natin sa Facebook, laging mga hindi magandang balita. Ayan. So, ito po yung isa sa gusto nating i-point out din po for today. Let's have a check-up kahit hindi tayo doctor, check-up tayo. Do you take medicines without prescription? Ayan. Pwede naman po, over the counter. Pero kapag serious condition, again, dapat may prescription na. Do you experience unwanted effects after taking a medication? So kapag may naramdamang hindi maganda, consult the health professional. Do you often buy over-the-counter medicinal products? Okay lang po iyon. Pero kapag napansin po natin na, bakit madalas akong umiinom ng over-the-counter? Ibang condition po yun. Kailangan na dapat talagang ma-check up. Do you consult the drug label before taking the medication? Ugaliin po natin basahin yung label. Kasi baka expired na din yung gamot na napunta sa atin or mali ang naibigay sa atin. Do you increase the dose of the drug when you do not feel the effects? So we do not increase the dose po kasi magiging toxic din po sa atin iyon. Ito po, ayan, kasi exam. Sabi nga po, lady kanina, exam. Exam week, kaya magpapa-exam na rin po ako. Ayan po, true or false, eating ampalaya causes hypertension. Marami po kasi tayong mga nakakausap. Ayan. Bawal ako ng ampalaya kasi high blood ako. Ayun, di ba ma'am? May mga ganoon po kasing kaisipan. Pero again, hindi po. Kasi po, iba naman po yung ampalaya will promote iron storage in the blood. At iba po yung hypertension kasi ito po ay tungkol na sa pressure, blood pressure. So magkaiba po iyon. Iba yung iron sa mga anemic, iba naman yung hypertension. Yan. Kaya po sabi ko, minsan sa mga nakakausap natin, huwag nyo naman laging pagbintangan yung ampalaya, kaya siya lalong nagiging bitter. Ayun. Ayun po. And then, astringent plus clindamycin from capsules, ginagawa po ng iba, astringent, haluan ng clindamycin, ilalagay sa mukha. Yun nga po ang hindi tama dahil the reason why it was made a capsule is because it is meant to be taken internally. So we do not take anything from the capsule and put it in our skin. If we need a skin product, it has to be formulated as a skin product because there are added absorption enhancer, permeation enhancer, para po mas ma-absorb ng ating balat. So hindi po natin dapat ginagawa. Next, herbal medicines do not cause side effect. Ayan. So, hindi din po. Just because it's herbal doesn't mean that it's always safe. Later, we will talk about this po. Ayan po. And, ayan po, antibiotic treatment can be stopped if you begin to feel better. Ayan po yung isa din sa ating dinidiscourage. When the doctor tells us to take it for 7 days, 14 days, it means that it is the time until when we are sure that the infection will be cured. So, dapat susundin natin po yung regimen. And true or false, do not take maintenance medication so that you will not be tolerant to the effect. Yung iba po sabi, ay, wag mo sanayin yung katawan mo sa maintenance. But again, the point that is being given by the doctor, that the maintenance medicine is being given by the doctor, is that it is meant really to control a chronic condition. For example, hypertension, diabetes. So, kapag hindi na po ito gumagana, ite-tailor naman po ito ng doktor para babaan ng dose, taasan ng dose, o palitan na po ng ibang gamot. And then, ayan, only branded medicines are effective. Ayan, so, mamaya pag-usapan natin si generic versus branded. Ayun po. Kapag sinabi nating drugs, most of the time, people think of drugs na nakaka-addict. Pero pag tiningnan po natin sa mga libro and even in the law, drugs would be always synonymous to medicines also. So, drugs are taken to cure or treat diseases. Ayan. Okay, ayan po. So, to cure or treat diseases, kapag sinabi pong cure, wala na yung kondisyon. So, one example would be an infection. Okay po, pagka-cure, antibiotic, cured ka na, magaling ka na kasi wala na yung infection. Kapag treat naman po, it happens when the condition cannot be cured. But instead, it is managed. Kapag mitigate, it will prevent the progression of the disease. Gamot din po yung ginagamit para ma-diagnose yung disease. At yung mga vitamins and vaccines, we also consider them as medicines because they prevent the disease. So, yun po. Can we cure or treat the asthma? Siyempre, treat lang po. Diabetes, treat lang din. And respiratory infection, treat lang din po. Okay. So, kanina, na-mention po natin, yan, are natural drugs always safer? Ayan. So, when we talk about natural drugs, ito na po, the US Department of Health, National Institutes of Health, National Center for Complementary and Integrative Health are telling us that natural doesn't necessarily mean safer or better. Kasi po, many people would think kapag natural, better, healthier, or safer than unnatural drugs. However, there are a lot of drugs that come from nature that have been shown in laboratories that are not effective. For example po, yung echinacea, ginagamit po nila ito for symptomatic treatment of colds. Pero wala po silang nakitang sapat na evidence. Ginkgo, ayun po, ginagamit sa traditional Chinese medicine. However, there is a study as presented by the National Institutes of Health po that it does not prevent or slow dementia at all. Ayun po. And also, natural does not always mean safe. We have plants, for example, si kava po, dietary supplement for anxiety. But if you take it, you will have severe liver damage.
Wow.
For ephedra, this has been used for centuries already for cough, colds. And also, we also have some ephedrine-derived products, but this has been stopped by the US FDA because it would be causing heart problems and the risk of death. Natural doesn't always mean that it is safe. And for many, pag sinabing chemical, usually they think na ay toxic, ay synthetic, hindi maganda. But come to think of it, everything is made out of chemicals, also even the plants. Kaya po tawag natin din phytochemicals. Even our body is made of chemicals, biochemistry. And even the air that we breathe, diba po, ayun, may oxygen is also made up of molecules or the chemicals. So, yun po yung common misconception that natural is always safe doesn't necessarily hold true. And therefore, if you do take natural products, it has to be, again, taken in moderation. So, ayun po yung key term natin. Temperance, moderation. Ayan. Generic versus branded. Bakit mas mahal yung branded? Kasi po, ayan, we also have to acknowledge that they are the innovator drug. Ibig sabihin, it is the first drug that was originally marketed anywhere in the world. So, nag-research yung mga drug manufacturers, drug companies. Tapos, syempre, ipapapatent po nila iyon. they also have to shoulder all of the cost for the research, the first initial testing, ano po yung mga clinical trial. So medyo magastos po yun. Kaya po pag unang labas ng gamot, talaga pong mas mahal siya. And then after the patent expires, then that's the time when other manufacturers can manufacture the generics na po. So since may nauna ng research, gagamitin na lang nila yung data ng naunang research, ang kanilang cost na lang naman po is on manufacture, or pwede din silang mag-substitute na ng ibang excipient na alam naman nilang tatalab pa din. No? So mas mapapababa po nila yung cost ng gamot. And generic doesn't always mean branded, unbranded, because we also have the branded generics na din po. Ayun. Okay.
Grabe, Ma'am Vina, sa iyong discussion, ang dami-dami ko pong natututunan at talagang nag-aabang din ako kung ano ang mga tanong ng ating mga kasamahan na nakikinig sa atin.
Po, Mami.
Sige po, tuloy po tayo dahil talagang full of information po itong topic ni Ma'am Vina.
Yes, ma'am. Inaanday ko din po yung tanong eh. Sabi ko, hala, nahihiya silang magtanong.
Huwag po kayong mahiyang magtanong.
Wow. Ayan, sana ma-sponsor na tayo sa catchphrase po. Anyway, ayan po. In other countries, we have prescription pharmacies only, OTCs, and we have OTCs. But in the Philippines, we have the prescription products, we have the over-the-counter medications, then we have the household remedies. So tatlo lang po yung classification natin. Bakit yung ibang gamot kailangan dereseta? Bakit yung iba pwede naman over-the-counter? So kapag prescription products po kasi, prescription drugs, ito po yung mga gamot na pwedeng magkaroon ng adverse reaction kapag hindi tama yung diagnosis ni doktor. Pag ininom mo to, for example, gamot para sa diabetes, hindi ka naman diabetic. So, posibleng bumaba yung sugar po, no? So, malaki po ang magiging epekto sa kalusugan ng tao. Anti-hypertensive, hindi ka naman pala hypertensive. Akala mo lang masakit yung balikat mo, feeling mo hypertension na yun. So, ininom mo din yung gamot, for example, ng kapitbahay. So, hypotension, mas malaking problema. Kaya kailangan prescription product lang po siya. These are drugs that can cause undesirable and dangerous after effect. This can cause therapeutic failure when used at the wrong dose. Antibiotic, sige, gamit kahit hindi direseta. Hindi rin yun tatalab. Una, baka na-overdose tayo. Pangalawa, bakit hindi gumagaling yung infection ko? Kasi kulang pala yung dose, no? Parang once a day mo lang ginagamit yung antibiotic, dapat twice pala siya. Or these are products that can cause addiction to the drug because of the psychoactive substances. So it legally requires a physician's diagnosis, a physician's prescription, and veterinarian or dentist prescription. Next question po na na-encounter. Meron po kami na-encounter, wow, dentist, pero nagreseta ng gamot pang hypertension. Meron din pong veterinarian, nagre-reseta ng gamot ng diabetes. So, yun po, even if the law tells us that physician, veterinarian, dentist can give prescription, they should also be aware of each other's boundaries and responsibilities. And therefore, the dentist will only issue medications for the oral health and for the teeth, ganyan. Veterinarian, only for animal use. For physician, of course, for human consumption. Hindi pwedeng mag-overlap po sila. And then for over-the-counter medicines, these are medicines that do not need the prescription or approval of a medical pharmacy or a veterinary professional. It is safe and effective if you use it according to what is written on the label. And it is only used for symptomatic relief lang po ng minor ailment na napag-usapan natin kanina. Kapag home remedy, kasali din po yun, tinatawag din po natin silang medicines. Kapag nag-register din po sila sa FDA, under din po sila ng medicines. So example po nun, yung mga alam nating acete alcamporado, yung ginagamit po ng mga lolo't lola, no? Acete de manzanilla, hydrogen peroxide, castor oil, mineral oil, tincture of iodine. Ayan. So yun po ay tinatawag naman nating home remedies. Ayan. Next, ano yung food supplement? Ayan. Ang food supplement ba ay gamot? kapag nag-register po sila sa FDA, magkaiba po yung kanilang category. It can be called as a food or dietary supplement if it would have no therapeutic claims. Kung mapapanood po natin sa TV, ito po yung mga may commercial na no approved therapeutic claim. Ang gamot na ito ay hindi gamot at bawal gamiting gamot, parang ganun po. Ayun po yung inilalabas. So, they are considered as dietary supplement. However, ayan, vitamins, gamot ba sila o food supplement? Less than 150% of the recommended energy and nutrient intake for water-soluble vitamins like vitamin C, food supplement lang siya. Kapag fat-soluble naman po yun yung vitamin A, vitamin D, vitamin E, vitamin K. So, mas a little more toxic po siya than the water-soluble. So, dapat, para makonsider siya na dietary supplement, it should be below 105% lang po. So, let's try to see if vitamin C, yan, kasi lagi pong ginagamit yung, laging ginagamit ngayon po ang vitamin C. So, kapag tayo po ay iinom ng vitamin C, no, to raise our immunity, is it considered as a food supplement or a drug? According to FNRI natin ng Pilipinas, the Philippine FNRI, in 2015, for adults, the recommended intake of vitamin C for males should be 70 milligrams. For females, 60 milligrams. But what is available in the market po that we are normally using once a day, 500 milligrams po, no? It is already considered as a drug. Hindi na natin sasabihin na dietary supplement siya. It is already a drug kasi higher than the RENI na po siya. Ayan. Okay. So, ano naman yung dose? Ayan. Ano yung dose? Ano yung dosage? Kapag sinabing 5 ml of the syrup, okay, or 1 tablet, it's 1 dose only at one given time. But if the doctor tells us you have to take this 3 times a day for 7 days, then that's when we call it as the dosage na. Anong dosage ng gamot? Ayan. 3 capsules 3 times a day for ganyan, for 7 days. And for household remedies, many times that we will not have an available measuring material in our house, no? 1 teaspoonful is already, pag sa mga bata po, pag nagpapainom tayo ng gamot, no? 5 ml po iyon. Ang 1 tablespoonful po, wag lang yung galing Baguio na pang-display. Yung ordinary po, 15 ml lang po dapat talaga iyon. Kapag teacup, yan, yung pang tea, 180 ml po iyon. At yung ating mug, baso, or ordinary glass, that's already equivalent to 250 ml. So, ito po yung guide natin. If ever, wala tayong pangsukat. Oops, ayan. So, ayun po. Taking the medicines responsibly, how do we do it? Kapag sinabi po natin, rational use of medicine, ayan, baka sabihin, nagpo-promote tayo. Right medicine for right patient, right dose, right route, right time, and right cost. Magiging rational lang po ang lahat kung lahat ay tama. Nasunod ang dose, nasunod ang oras, tamang halaga, ayan, at tamang pasyente. Hindi pwede yung sabi ni Aling Marites, ito inumin mo, tumalab sa akin. Ay hindi po yun rational use of medicine. It would only be also the right medicine if the patient adheres to treatment. After all, the best and the safest, the most effective, and the medicine with the highest quality will not be the best medicine at all if the patient is not taking it. So, patient should definitely adhere to the treatment. Okay. Ano po yung mga forms of irrational medicine? Yung po yung marami masyadong gamot, sobrang gumamit ng antibiotic, inappropriate self-medication, and it is dangerous because it could lead to unnecessary adverse events, yan, increasing antimicrobial resistance, predisposition to secondary infections, yan, increase hospital stay and cost of hospitalization. So, instead na makagaling, mas makakasama pa po. Ang nais po nating tatandaan lang sa mga gamot, it is a double-edged sword in the manner in which it can heal, it can also kill. So, dapat hindi din po tayo abusive sa paggamit ng gamot na, hey, take natin to, ganyan. Again, sabi nga po, ng African proverb, if it is not broken, do not fix it. Okay? And, yan, if ever po na walang tanong, ayan, ako na din yung magtatanong po. So what do we do? Ay, na-miss ko yung gamot. Ano pong dapat gawin? Didoblehin. Ay, hindi pwede po yun kasi baka tumaas yung risk of side effect. Bakit yung ibang gamot dapat walang laman ang tiyan? Okay, dapat empty stomach. Kasi po, some of the medicines, when you take it at the same time as eating, it can prevent your stomach and intestine from absorbing the medicine, making it less effective. Some foods may also interact with the medicine, baka ma-neutralize. And pag sinabing, take this on an empty stomach, it has to be taken 1 hour before the meal. Hindi pwedeng, sige, bago kumain, tapos kain ka na. Hindi yun empty stomach. Ayun po. Should be 1 hour before the meal or 2 hours after the meal. Ayan. Bakit naman po ibang gamot dapat with or after food or after meals? Kasi una, to reduce the side effect of nausea, vomiting, to reduce side effect or irritation, to ensure that the medicine is absorbed, and to help the body process the meal. And ayan po, yung last natin na question, ayan, ano ibig sabihin na expiry date? Bakit yung ibang gamot po nakalagay use by date? Kapag ang nakalagay po sa ating gamot, expiry date, July 2020, ibig sabihin po, aabot po iyon hanggang katapusan ng buwan. Huwag nyo na po siyang gagamitin after July 31. Expired na po siya. Ayan. Pero pag ang nakita nyo po, yung mga, halimbawa, yung tinitimpla po namin sa butika ng mga antibiotic suspension para sa mga bata, nakalagay po doon, use by July 2020. Ibig sabihin po, dapat gamit na siya bago mag-July. Huwag nyo na po siyang gagamitin pagkatapos ng June 30. So, yun po yung pinagkaiba niya. Ibig sabihin, huwag nyo nang paabutin ng July 1. Parang ganun po. Ayun po yung pinagkaiba natin. So, we still have other tips po dito, but bottom line, the take-home message is, when you are given instructions, for example, after consultation, it would be always best to clarify instructions with your doctor para po tama at safe ang paggamit ng ating gamot. Always clarify the instructions if you feel confused po. And linawin ang sumusunod kapag sinabing inumin batay sa direksyon. Ano yung direksyon? Pag sinabing inumin 4 na beses sa isang araw, ibig sabihin 24 hours na pinag-uusapan. So ibig sabihin every 6 o'clock, 12 o'clock, 6 o'clock ulit, or yun lang sa mga oras nagising ka. So those are the things that we also have to clarify. Inumin kung kinakailangan. Ano ibig sabihin ng kinakailangan? Yan. Pag sinabing uminom ng 2 tableta araw-araw, kailan iinumin? 2 tableta sa umaga, 2 tableta sa hapon, o 1 sa umaga, 1 sa hapon. Pag sinabing inumin bago matulog, eksakto bago matulog, o 1-2 oras bago matulog. Pag sinabing inumin bago kumain, dapat as in bago tayo kumain, or 1-2 oras bago ito. Laging tandaan, dapat po malinaw ang direksyon bago natin iinumin ang gamot. Ayun.
Awesome! Grabe, Ma'am Vina. Ang dami ko pong natutunan sa lecture nyo ngayong umaga. Talagang yung pag-inom ng gamot, hindi pala siya biro at hindi rin dapat baliwalain. At ang isa sa tumatak sa akin, hindi porke natural ay safe. Kailangan makipag-coordinate din talaga. May partnership sa doktor, sa pharmacist, maliwanagan po tayo. Kasi lagi talaga, Ma'am Vina, no, yun talaga yung kaisipan nating lahat. Pag natural, mas safe yan. Pero pag may chemical, naku, toxic yan sa katawan. Mga kaibigan, kung hindi nyo po napanood ng buo ang lecture na ito, ulitin nyo po. Dahil napakarami po talagang importanteng information na binigay sa atin ni Ma'am Vina today. Ma'am, akin pong titingnan kung meron tayong mga hindi nahiyang magtanong. Pero bago po natin sagutin yan, mga kaibigan, panoorin niyo po muna ito.
Are you suffering from heart disease, diabetes, hypertension, obesity, stroke, anxiety, and other lifestyle diseases? We can help you. Join our Lifestyle is Medicine intervention program. This is a 6-week virtual health program, Tuesdays and Thursdays at 6 to 8 p.m. that will bring your lifestyle doctors and dietitians right where you are. There will be scientific evidence-based lectures, health screening, cooking demonstrations, workbook, and recipes that will help you in your health journey. Find out what is the optimal nutrition for your health conditions and activities fit for you. This holistic lifestyle intervention program will help you and your family to experience the best life in the midst of uncertainty and stressful living. Contact us at Adventist Med Lifestyle Medicine Facebook page for details and registration. Join now!
Linda Varona, the best pa rin talaga ang lifestyle. Pero sa atin pong napag-usapan ngayon, ang pag-inom po ng mga gamot ay talagang makakatulong din dahil yan nga po ay inireseta para kayo ay gumaling. Ma'am Vina, meron po ditong isang tanong na naniniwala po ako marami din ang magbe-benefit kung atin itong sasagutin. Ang sabi po niya, totoo po ba na ang pag-inom ng mga gamot ay in the end, makakasira naman ito daw ng mga internal organs or ibang organs natin?
Actually, ma'am, that's also the one thing that we also have to remember. It is not parang natural or inherent in the body po. So yun po yung sinasabi natin, if it is not indicated, kung hindi naman ito talaga para makagaling sa atin, huwag nating iinumin. Dahil totoo naman din po in the long run, if we keep on taking a medicine that is not meant to treat a condition, it can definitely be harmful to our body pa po.
Thank you so much po, Ma'am Vina. Meron naman ditong tanong. Sabi niya po, pwede daw bang inumin ang cetirizine? Wala naman daw po siyang reseta.
Actually po, ang ating cetirizine ay over-the-counter naman po siya. So, pwede naman po, unless yun nga din po yung una, we also have to seek wisdom on whether our body really needs it. But kung feeling natin kailangan, okay naman po siya dahil ito po ay over-the-counter product. So, okay lang po.
Thank you po. Ma'am Vina, isang tanong na lang po dahil napakabilis ng oras. Sabi po dito, sabi po niya, ano daw po nga ulit yung gamot, yung natural na gamot na inyo pong nabanggit kanina na yun pala, hindi natin alam, nakakasira din ng katawan, pero natural.
Apo. Yung example po natin kanina, kava, hindi po siguro masyadong familiar na ginagamit sa atin. At saka ephedra po, which is normally used in some traditional Chinese medicine po. So, yun.
Alright. So, ayun nga mga kaibigan, ang dami po nating information na napulot sa araw na ito coming from our specialist today, isang pharmacist. At ito pong mga napag-usapan natin, kung hindi nyo po napanood ng buo, I really encourage you po, i-replay nyo po ito, watch it again, and share with your family and loved ones. Ma'am Vina, bago tayo magtapos, baka meron po kayong remarks sa atin po mga taga-subaybay.
Una po, nais ko po magpasalamat sa lahat po ng nakabahagi natin ngayong umaga. Isa pong malaking karangalan po na tayo po ay nakasama sa programa na ito. Ang una lang pong ating hinihiling, again, sabi po natin, kapag hindi kailangan, huwag inumin. Kapag hindi sigurado, magtanong sa doktor. Kapag kailangan nyo ng tulong tungkol sa gamot, naandito po ang inyong mga pharmacist para tumulong sa inyo.
Amen. At mga kaibigan, nais kong tapusin ang ating episode sa araw na ito sa pamamagitan ng isang panalangin. Hayaan niyo pong ipag-pray ko po kayo. Let's pray. Ama naming Diyos na nasa langit, alam po namin na ang mundo ngayon ay maraming mga nagaganap na kung ano-ano. At madalas kami po ay nagkakasakit, nakakaranas ng kung anong pakiramdam. Marami po ang nagkakaroon ng depression and anxiety, kasama na po ng iba pang mga karamdaman maliban sa COVID. Ang hiling po namin sa araw na ito, hipuin niyo po ang bawat may sakit ngayon upang sila ay magkaroon ng kagalingan. Hiling din po namin na bigyang suporta po sa kanilang mga pangangailangan ang bawat pamilya na nakakaranas ng hirap. Panginoon, binibigay po namin sa inyo ang aming mga sarili sa araw na ito. Nawa po ang inyong bendisyon at ang inyong proteksyon ang sumaamin. Ito po ang aming dalangin sa pangalan ni Jesus. Amen. Mga kaibigan, maraming salamat po sa inyong pagtutok at pagsuporta dito sa ating programang Voice of Health. Sana po huwag kayong makalimot na ito po ay bantayan at abangan Mondays, Wednesdays, and Fridays, 11 to 12 p.m. Pero doon po sa DWBL 1242, tayo po ay 12 to 1 na live. Marami pong salamat sa inyong lahat na tumutok ngayon at sa mga nagpadala ng question, thank you po. We really appreciate your engagement sa ating program. Yun lamang po, magkita-kita tayo ulit sa sunod na episode. Manatili po nawa kayo lahat na masaya, malusog at masigla. Ito po ang Voice of Health, nagpapaalala, your lifestyle is medicine.